歡迎各位傳媒今日嚟到。
Welcome to the media briefing on the COVID-19 vaccination program. With us are Mr. Patrick Nip, Secretary for the Civil Service, and Professor Sophia Chan, Secretary for Food and Health. The two secretaries will speak, and then we will have a question and answer session. Mr. Nip, please. Friends of the media, members of the public, good afternoon. The COVID-19 vaccination program officially started on the 26th of February, and today is the 11th day of the program. Over the past 10 days or so, we gradually rolled out the vaccination program. On the 26th of February, 5 community vaccination centers were put into use, and starting from March the 6th, another 3 community vaccination centers joined the program. Starting from March the 2nd, members of the public can be vaccinated at private medical clinics. And as such, those who fall within the 5 priority groups could receive Sinovac vaccines at 8 community vaccination centers, 18 general outpatient clinics under the hospital authority, and private medical clinics. As for the community vaccine, the 5 priority groups can receive the community vaccine starting from March the 10th, that is Wednesday, at any of the 7 vaccination centers of the hospital authority. Since last Saturday, that is March the 6th, the government and hospital authority has arranged for the priority groups to receive the community vaccine at the 7 vaccination centers. As a whole, since the vaccination program started, operation has been smooth. As of 8 p.m. last night, a total of more than 93,000 members of the public received the first dose of a vaccine, of which 91.8 thousand doses were Sinovac vaccines and 1,200 doses were community vaccines. As for the means of vaccination, 60.8 thousand doses were administered at community vaccination centers, 29.6 thousand were administered at private clinics, and the rest were administered at the GOPCs of the hospital authority. We have planned for a total of 29 community vaccination centers. 8 are currently used for the administration of Sinovac vaccines. 7 centers operated by the hospital authority will begin operation on March the 10th. And of the remaining 14 vaccination centers, the Queen Elizabeth Stadium and Homentin Sports Center facilities would be put into use later due to current renovation works and sport events. Starting from March the 16th, that is next Tuesday, we will open up 12 vaccination centers to administer the community vaccines. You can browse the addresses of these community centers at our thematic website. Most of these centers are situated at government venues, including sports centers, and 5 are located in private hospitals. Starting from tomorrow, that is Tuesday, the public can book places at the online booking system of the thematic website, and members of the public can book places from the 16th to 30th of March at any of the 12 new community vaccination centers, and there are about 140,000 places for the community vaccine. In order to provide convenience to the public, starting from Wednesday, the booking system will open up places for an extra day at 9 a.m. every day, and based on the current situation, an extra 16,000 community places will be available for the first and second doses. For the Sinovac vaccine, there will be an additional 6,000 places every day for reservation. More than 1.4 thousand private medical practitioners and 2,000 vaccination spots or points have participated in the program, and we believe this would help meet public demand. And as you know, 758,000 doses of community vaccine arrived in Hong Kong yesterday, and together with the 585,000 doses that arrived in Hong Kong on February the 27th, altogether 1.343 million doses of community vaccine have already arrived in Hong Kong. The vaccination program requires detailed planning and flexible deployment to allow the vaccination drive to proceed in a safe, orderly, sound, and efficient manner. In light of the current supply of vaccines and the progress of vaccination, we will follow the proposed priorities recommended by the Joint Scientific Committee in expanding the scope of the priority groups to include the following 7 types of people who are at risk of higher contact and infection. And these include 1. Staff of the catering sector, wet markets, supermarkets, and convenience stores, as well as delivery workers. And this includes delivery workers for takeaway food. 2. Public transport practitioners. And these include drivers of taxis, buses, minibuses, railway captains, bus stop staff, etc. 3. Registered construction workers. 4. Property management staff, including security personnel, cleaners, management office staff. 5. School teachers and staff. For example, the staff of kindergartens, primary and secondary schools, and universities, as well as their support staff, staff of special schools, school shuttle drivers, and their escorts. 6. Frontline practitioners of the tourism sector. 7. Staff of scheduled premises under Cap 599F, such as the staff of fitness centers and beauty parlors. And the new priority groups will cover about 1.3 million people. In other words, together with the earlier designated priority groups, the priority groups will now cover about 3.7 million people. And as such, we can proceed with the vaccination drive in a safe and orderly manner while maintaining flexibility based on the actual operation and supply of vaccines, so that we can enhance or expand the scope and speed of vaccination. The new priority groups can start booking places at the online system starting from 9 a.m. tomorrow, or be vaccinated at private clinics. Given the current global pandemic, vaccination is an essential part of us resuming our normal lives, and the vaccines are also precious. Hong Kong is both lucky and fortunate to be able to receive a supply of vaccines. Currently, the total number of people vaccinated around the world has exceeded the total caseload. More than 100 million people around the world have received at least 1 dose of COVID-19 vaccine. According to information provided by pharmaceutical companies, the total number of community vaccine supply around the world has exceeded 60 million, and more than 40 million doses of Sinovac vaccines have been administered. We urge all priority groups to take this chance to be vaccinated to protect themselves and their families. I'd like to invite the Secretary for Food and Health to talk about the vaccination exercise.
Friends and friends from the media and citizens. Well, the vaccination program for COVID-19 started last month, and the response has been very enthusiastic. And since 22nd of February, a total of some 93,000 citizens have already received the first dose of the vaccine. As you might be aware, other than Sinovac, some members of the public have already made appointments for taking the community vaccine, and they can start from Wednesday this week, that is the 10th of March. And last Saturday, at the 7 CVCs, operated by the hospital authority. Both myself and also Mr. Henry Fan, the CEO of the HA, and also Dr. Tony Ko paid a visit to the vaccination center at Shui Long Sham Road Sports Center. We also looked at how it operated, and also we went to Lai Chi Kok Park Sports Center, and it's also located on Kowloon West, and also the Yuen Long Sports Center. So it's also in NT West cluster. So they are all operated by the HA, and looking at the workflow, overall speaking, is very smooth, and we also try to encourage those healthcare professionals working there. We could also see that, for members of the public taking the jab, whether it's Sinovac or Comirnaty, they were getting that very smoothly. And I understand that there have been two incidents which had some adverse events, and members of the public would be very concerned about this. And the Expert Committee on Clinical Events Assessment following COVID-19 immunization already held an emergency meeting last Wednesday following a serious adverse event, and the experts looked at the existing cases information, including the condition of the patient and also his medical record, and also some clinical data, as well as some findings relating to the initial autopsy and also the information relating to the vaccine. And they also looked at the computation flow chart provided by the WHO, and also the causal relationship. And the expert committee's view was that the death of the patient should have no direct causal relationship with the vaccine, but then they would also have to wait until after the full findings of the autopsy are available before they can draw any conclusion from that. With regard to the second serious adverse event, the Department of Health already passed the case to the expert committee to conduct an assessment on the causal relationship, and the expert committee is going to have a meeting this afternoon, and they'll be announcing the results afterwards in due course. The expert committee would also be discussing the two incidents reported by the HA, which require referral to the intensive care unit. They were suspected to have something to do with the adverse events following the COVID-19 immunization. And of course, the government is concerned about these adverse events reports, and given the vaccination program, if there is any such adverse events following the immunization, we do have a surveillance mechanism that is including death cases and so on. The expert committee would be looking at the individual cases, and they would conduct in-depth study and assessment following the incident. They would also make an assessment to see if there is any direct causal relationship or association. And we have also appointed the medical school of the Hong Kong U to look at cases involving the reactions to the immunization, and also they would also be monitoring any adverse events on their own initiative in order to find out if there is any discrepancy between such incidences and also the expected situation, and to see if the frequency rate is within the anticipation. And this is an ongoing process. And up till now, the expert committee has not had any evidence to show that there is any need to change its initial view that vaccination should carry more benefits than risks. That's the reason why we will continue with this vaccination program. We understand that for those with chronic illnesses, they might have anxieties about taking the jab. And in fact, for every vaccine, there would be contraindications and points to note. For example, according to the pharmaceutical company's information, for those with very serious chronic illnesses, and if their conditions are not yet under control, then they might not be suitable for taking the jab. And for those with very serious history of allergies, they would also have to consult their private doctors before taking the jab. And for individuals who might have any questions, we suggest that they should consult their family doctors or their doctors in charge before they take the jab. In fact, at private doctors' clinics and at general outpatient clinics of the HA, before they take the jab, they could also consult the doctors before doing so. In fact, as the Secretary just said, for different sectors, for example, those working in the catering sector, and also staff of listed premises, and also staff of schools and so on, they are now required to take the COVID-19 test on a regular basis. And we are now prepared to allow these specified groups to have priority in taking the jabs. And at the same time, of course, we have also considered, and that's an ongoing review process for those who have completed the vaccination program, and if they have already met the testing requirement on a regular basis, is there any room for relaxation? For example, can there be tests at longer intervals? And in due course, is it appropriate for us to lift the requirement for these people to undergo the COVID-19 test? So these will be kept under review. And of course, we do call upon these people to take the jab in order to protect both themselves and also those in the same trade. As to the supply of vaccines, well, the next batch of vaccine will be arriving within this month, according to the information that we have so far. With regard to Comirnaty, we can see that for the EU, they might activate the export control mechanism, and of course we are very concerned about this, and we'll be monitoring that closely. And as you can see, as Mr. Nip has already said, for the first batch of 758,000 doses, they already arrived in Hong Kong yesterday, and together with the first batch of 585,000 doses, altogether we have already had over 1.34 million doses of Comirnaty that have arrived. And we will be maintaining very close liaison with the pharmaceutical companies or APAs, that we have signed this agreement, and will ensure that the doses will arrive smoothly on schedule. As to AstraZeneca, we will also be confirming with them as to when they will arrive in Hong Kong. And once again, I'd like to stress that for those vaccines that we have procured, the experts have vetted it, and they are sure that they are safe, effective, and have quality assurance, and the benefit would outweigh the risk. And therefore, other than protecting yourselves and your families, is also going to be very important to safeguarding our public health care mechanism so that they can work smoothly, and also to our daily life and also our economy. That would also bring hope so that we can restore to normality sooner. So I hope that you can all work with us so that you can all take the jabs. Thank you. Next is question and answer. So for those who would like to ask questions, please raise your hands and please take the microphone before you speak, and also introduce yourselves before asking questions. Yes, the one in white in the second row. Well, I'm from TVB. Good afternoon. Well, there has been a spate of adverse events lately. So is there any line that has been drawn so that to what extent do we have to have such incidents before we can call it to a halt or suspend the program? Well, all along, the administration has been saying that, okay, if the condition is under control, even if you have chronic illnesses, it's okay. But then, are there any very clear thresholds? For example, if you're suffering from diabetes, what's the level that you have reached before you should stay away from the vaccination program and so on? So is there any threshold that you have drawn? And also, we are also starting to take BioNTech. According to some experts, the adverse effects could be even more serious when compared to Sinovac. So will there be more such incidents? And also, you're telling people that you should also install this app, that is the HA Go. So will you be calling upon those people so that they would consult their doctors instead of having the patients tell the doctors as to what conditions they have?
As for the means and arrangement of vaccination, I will provide some information before I hand over to Professor Chan for the surveillance. One of the means is our community vaccination centers. The idea is to provide convenience to the public for vaccination, especially for the community vaccine. Dilution is required and 5 doses are needed, and as such, administration can take place at vaccination centers. Vaccination centers are not a place for medical diagnosis, so regardless of the type of vaccine, the vaccination guidelines would be available on leaflets and our website, and as well as at the vaccination centers. For those who have questions, they may seek help from the staff at the centers. Yesterday, I visited a number of vaccination centers, and I saw that more doctors were deployed at the site to answer questions from the public. For instance, they can provide advice on whether the conditions of the members of the public are within control. Another means of vaccination is private medical clinics, and this is one of the means for the administration of Sinovac vaccines. And again, at the clinics, doctors can assess the conditions of the patients in deciding whether they are suitable for the jab. Another means would be the general outpatient clinics of the hospital or authority. Again, consultation could be provided at the clinics. For those who have questions about their conditions, especially the chronically ill, they can seek help from private doctors or family doctors. And having said that, we know that a lot of people would seek consultation from the HA's clinics. In that case, they can seek advice from their clinics in their next appointment, and after that they can make a decision whether or not to be vaccinated, and hopefully this can ease the worries of the public. The different means of vaccination each serves their own function, so we urge the public to make use of the different means. Thank you for your questions. For serious adverse events, this is of much concern to us, and the Department of Health also has an established reporting mechanism. Every day at public hospitals or A&E wards, we would see patients with various acute medical conditions, and the HA has a prevailing reporting mechanism. More than 90,000 people have been vaccinated, so the number of adverse events could increase with the number of people receiving vaccinations, and these incidents would be reported to the DH. Before the Expert Committee on Clinical Events Assessment following immunization analyzes the causal relationship, we are still uncertain whether these incidents were related to the vaccination. So we have a mechanism in place to deal with different cases and to make causality assessments. Once we have any information or conclusions, we would report the details to the public. If members of the public have any questions about the vaccines, information is actually available on the website on the specific vaccines, such as the matters to note and information on those who should not receive the vaccines. Members of the public would have access to such information before the actual vaccination. For those who are unsure about their own health conditions, they can first consult the advice of doctors, including private medical practitioners or doctors from specialist outpatient clinics of DHA. The Department of Health would maintain close communication with staff of the vaccination centers as well as private medical practitioners. As for whether there are hard standards or indicators for the chronically ill, our healthcare professionals are mostly well versed and they will maintain communication with the DH. As for the HA Go app, I hope more people would use this app or the e-health system. This is a platform to access the medical history of a patient by both private and public medical staff. But I'd like to remind the public that vaccination centers are not clinics. These vaccination centers have been operating smoothly, and there are doctors and healthcare professionals deployed at the site to answer any questions from the public. And they would be happy to answer any questions the public might have. If the healthcare professionals feel that certain individuals should not receive the vaccine, they will be notified accordingly, and they might be asked to first seek medical advice, and this is perfectly normal. We do have an ample supply of vaccines, so we urge the public not to get too anxious, and they should first assess their own conditions. Next question. I'm from Now TV. There were recent reports that another man in his 60s or 70s, he passed away at United Christian Hospital after receiving the Sinovac vaccine. Do you have more details on that? If this case is true, and altogether there were 3 deaths associated with the administration of vaccines. Is this the right time to expand the vaccination program? And what is your expectation on the reception? Secretary, you said there was no direct evidence associating the vaccination with these events. Would you first suspend vaccination for those above the age of 60 or those with hypertension, diabetes, etc.? Even with the e-health system, one cannot know the comprehensive medical history of a recipient. You are asking the public to seek medical advice or to pay attention to their own conditions. Are you shifting the risk of vaccination on the recipients themselves? And a question for Mr. Nip. In an interview, you said that 200 civil servants did not sign the declaration. What ranks or departments were involved, and did they include any directorate staff by not signing the declaration, does it mean they would leave the government?
嗰啲問題。
Well, with regard to incidents or matters with, other than the vaccination program, I think I'll answer on another occasion. With regard to the taking of the vaccine at the CVC and also for the e-patient or e-health record under HA Go, well, that would not be made available to the CVC because, as I said, the CVC has been set up for the purpose of providing vaccination to members of the public, and for every participating member of the public, they can have their own records and they can always upload that onto the HA Go apps. And for those going to take the jab, if they have any concerns about their own health or whether or not they are suitable for taking the jabs, well, most of them would have chronic illnesses, and mainly those are the more common chronic illnesses, and therefore when you make appointments with the CVC, you should also check the record. And at the CVC, the medical staff there would also try their best to answer any inquiries that the recipients might have. And if they have any questions or doubts about their suitability in taking the jab, then they would advise that they should stay away from that for the time being. But then if you are not having very serious concerns, or if you do not have very serious chronic illnesses and so on, the CVC would be very conveniently located for them to take the jabs. And therefore, under the priority groups, starting from tomorrow, we will be expanding that further. We believe that that's appropriate, because if you look at the current supply, whether it's Sinovac or Comirnaty, the supply is adequate, and we have also got CVCs that are ready to serve the community, and quite a large number of members of the public. Given the fact that we have also introduced more groups that would be given priority in taking the jabs, they would also like to take the jabs, because in many sectors right now they are required to do regular testing, or they also have high exposure to the virus, and therefore to them taking the jabs would be a lot better and safer. And of course, we would also have to look at the current trends of the pandemic. Well, taking the vaccination would obviously be the best choice. In fact, at different places in the world, they have already started the vaccination program, and in those places, similarly, they would also have some adverse effects or events. Some would be mild, some would be rather serious. And therefore, what's most important is that we have to look into those cases to see if there is any direct causal association, so that we would be able to find out the causes of such events. I think that's the purpose of the expert committee and the DH, which have been monitoring the situation closely, so that they can do the analysis and give us their advice. So we'll be acting in accordance with the experts' views, and we'll be doing what we should under the vaccination program. So the most important thing is safety, and safety always comes first. Indeed, inevitably, there would be some adverse events or side effects, whether it's Sinovac or Comirnaty. Inevitably, there might be some adverse events. But then, once we have taken a decision to have these vaccines introduced into Hong Kong, we have already made the judgment that they are safe and appropriate. Well, I've already explained that at the CVCs, we would not arrange for the e-health available to check the health records of the patients taking the jab, because it's not supposed to be a place for medical consultation, and therefore if they have any doubts about their own conditions, they should always go to see their own doctors at the outpatient clinics to find out if they are suitable to take the jabs. At the CVCs, the medical staff there are ready to answer any questions that the patients might have. And safety is always the first consideration. And therefore, it's not appropriate for them to have e-health ready, so that before taking the jab, everybody will have to check their e-health record with the doctor there, because that's not supposed to be the case. Okay, next, in the second row. Sorry. Well, I'd just like to reiterate that if there are any clinical conditions or serious adverse events, then the DFH will look into it. First, the HA will report those cases to the DFH, and then we will also be making the announcements, and investigations will be carried out. And also, if you look at the overall situation in Hong Kong with regard to the pandemic, and also globally, vaccination has given us a ray of hope. And therefore, according to the experts, the approved vaccines are regarded as safe and have quality assurance. And overall speaking, the benefit outweighs the risk. And therefore, we will continue with this vaccination program. And as the SCS just said, other than those who are now given priority in taking the jabs, we are also prepared to expand the groups of people who will have priority in taking the vaccine. But then individuals who might have concerns about their own suitability in taking the jabs, they should consult their own doctors before doing so. I'll answer all the questions relating to the vaccines first, and for others, they will follow later. Yes, for all these adverse events, if there are any, the DFH will be announcing them. On the right-hand side, the second row, the male reporter.
Can I ask, in your professional opinion, how do you view the rate of the 4 suspected serious adverse events among some 93,000 doses of CoronaVac administered, compared to the rates among other countries who have also administered the Sinovac vaccine, such as perhaps Brazil or other countries in Europe or in Asia as well? Thank you.
Thank you for your question. First of all, I think we review, some of the data from the rest of the countries who have vaccinated Sinovac, as well as other or BioNTech vaccine in terms of understanding more about the adverse events reported. However, the adverse events reported is only the first step. The most important is for our expert committee to review and also to assess and analyze the causality assessment. That is whether the adverse events is directly related to vaccination. So until and unless we have established this relationship, the current rate is probably not comparable at this stage. But of course, we will continue to review the situation and also review not only the vaccination data, but also the data, for example, that is the data of having these adverse events, which it happens every day in the hospital authority, accident and emergency departments. We will also review all these different rates, and the Department of Health and the hospital authority is looking at these statistics, and once we have more information, they will report.
好，最後一個提問。
Last question, please. The female reporter on the front row, please. Good afternoon. I'm from the Hong Kong Economic Times. In terms of the expanded priority groups, they will cover catering staff and staff of beauty salons. After they are vaccinated, Do they still have to be tested every 14 days, or would some flexibility be offered? For staff of scheduled premises who fall under priority groups, but some of the premises are yet to reopen. Once the staff are vaccinated, would you allow the closed premises to reopen? For the expanded priority groups and after introducing the new vaccination centers, what would be the manpower demands? There were earlier reports that the HA refused to allow staff to be to help out at the vaccination centers. Apart from the information on the number of daily vaccinations, would you provide details such as age groups? As we gradually roll out the vaccination program, the priority groups are in accordance with the recommendations of the Joint Scientific Committee. At the third wave of the epidemic, Hong Kong saw infections among the elderly with a high mortality rate, and the number of casualties were 200. And as such, we are looking at a high-risk group, and this is one of the priority groups recommended by the scientific committee. Another priority group would be those providing certain services in our community, and that is why we are expanding the priority groups to include 7 new types of people. And these are people at a higher risk of exposure and contact. We have planned for a total of 29 community vaccination centers, and we have planned for manpower accordingly, and there are no issues with manpower. As for the issue of HA approving staff to be deployed at vaccination centers, the HA has clarified the issue by indicating that they are very happy to support the exercise on the premise that current HA services would not be affected. As for the information we announce, we would strive to be as open and transparent as we can, so the figures we announce would reflect the actual situation. And the information or numbers would reflect the trend in vaccination. We will continue to review the situation and consider disclosing appropriate information. You asked about the expanded priority groups to include staff of the catering industry or staff of scheduled premises. We hope that these priority groups will take up the vaccines once the relevant staff receive 2 doses of a vaccine. As to whether we can relax the requirement on the frequency of testing, that would be based on the premise that the relevant staff have received 2 doses of a vaccine, and we will also continue to review the figures and advice from experts. We will review our testing and other arrangements to see if there's any room for relaxation.
English
但我
question. Yes.
我答一答最後頭先提過另一個。
I will address an earlier question that was not related to vaccination. As for the oath signing or declaration signing requirement for civil servants, for current civil servants, by the end of last month, all the civil servants who had to sign declaration already submitted the forms, and the relevant departments and bureaus are collating the information, and they will report the situation to the Civil Service Bureau. By then, we will have a clearer picture. From the numbers so far, 1 to 200 civil servants did not sign the declaration, but as for the actual figures and breakdown, we are yet to have the details, and this is something we will report later on. And in April, we will report to the relevant LegCo panel. As we said earlier, for civil servants who did not sign the declaration, we would trigger the relevant personnel mechanism to follow up on the cases. For civil servants who refuse to sign the declaration, that means they would not shoulder their obligation, and we could lose trust in them, and according to the mechanism, they would leave the civil service. There is a mechanism in place, and we would also find out about the relevant causes. This is the end of the press briefing. Thank you.